Hi, how are you? First of all, please, it's very important that you help me to continue creating content. Subscribe to the channel, leave your likes, and tell me what you think at the end of the video. Is US GDP growing? Supply bottlenecks and COVID slow US GDP expansion. GDP grew at an annualized rate of 2% after expanding by 6.7% in the second quarter. U.S. economic growth decelerated above expectations in the third quarter, to the weakest pace in the pandemic recovery period, under the impact of bottlenecks in supply chains and an increase in COVID-19 cases, which limited spending and investments. GDP grew at an annualized rate of 2% after expanding by 6.7% in the second quarter, according to a preliminary estimate from the Commerce Department released on Thursday. The number reflects a strong deceleration in personal consumption, which rose only 1.6% after the 12% jump in the previous period. Scarcity, logistical bottlenecks, rising prices, and the Delta variant of the coronavirus weighed on spending on goods and services. The median of forecasts in a Bloomberg survey of economists pointed to a 2.6% GDP expansion. The data highlights how unprecedented pressure from supply chains is putting a brake on the U.S. economy. With a lack of labor and essential raw material, producers face difficulties in meeting the demand. Service providers, who feel similar pressures, performed better than the manufacturing sector in the quarter, despite the increase in COVID cases. While supply chain challenges are expected to last until 2022, the reduction in COVID-19 infections and high savings tend to support an increase in household spending in the last 3 months of the year. Looking ahead, we see a stronger pace of growth in the fourth quarter as household spending picks up, albeit with downside risk due to supply chain dislocations and shortages that could limit economic expansion in coming months, he said in Rubila Faruqi report, chief economist at High Frequency Economics. Persistent supply constraints combined with other effects of the reopening have also pushed up prices for many products, raising questions about the extent and duration of the recent pickup in inflation. The Personal Consumption Expenditure Price Index, excluding food and energy, an inflation measure closely followed by the Federal Reserve, remained high, rising 4.5% in the last quarter, after rising 6.1% in the 3 months above. The risks now clearly point to longer and more persistent bottlenecks and therefore higher inflation, said Fed Chairman Jerome Powell last week. Now we see higher inflation and bottlenecks lasting until next year. A larger trade deficit, reflecting record goods imports, further affected growth. Net exports subtracted 1.14 percentage points from GDP. Residential investment also declined. Inventories added more than 2 percentage points to GDP after consecutive quarters of declines. Another report released on Thursday showed that initial jobless claims fell to 281,000 last week, a new low for the pandemic. Continuing claims, which measure benefits in effect, dropped 237,000 in the week ended October 16, the biggest drop since July. Will U.S. start vaccinating children against COVID-19? COVID-19, U.S. agency approves use of Pfizer vaccine in children. In the public between 5 and 11 years old, the immunizing agent is applied in 2 doses, the second being 3 weeks after the first. The dosage is less than that used in adults. The Health Authority of the United States, FDA, its acronym in English, approved this Friday, 29. The possibility of using the vaccine against COVID-19 by Pfizer-BioNTech for children aged 5 to 11 years. According to the agency, the decision was made based on the analysis of data from an independent expert committee on the safety and efficacy of this brand of immunizing agent against COVID-19 in this public. According to test information, the effectiveness in people aged 5 to 11 years was 90.7%. Similar to that found in the range of 16 to 25 years. The study looked at 3,100 children in this age group who received doses of the Pfizer-BioNTech vaccine and found no serious side effects. The vaccine is given in 2 doses, the second being 3 weeks after the first. The dosage is less than that used in adults. The U.S. Centers for Disease Control and Prevention, CDC, is expected to hold a meeting next week to discuss the application of this vaccine to this audience and indicate protocols and recommendations on this immunization practice. Our rigorous process of evaluating data related to the safety and efficacy of the vaccine must help to ensure together with parents and guardians that this vaccine meets the highest standards, said FDA Commissioner Janet Woodcock. Thank you very much. See you next time.